Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Wonka. First, the highlights. Nigeria Center for Disease Control Director General reiterates safety of Oxford AstraZeneca vaccine while on working visit to Enugu State. Residents of Rivers say they are willing to take the vaccine, but blood clot allegations must be investigated. And United Arab Emirates gives half of its residents first shot of the COVID-19 vaccine ahead of its target deadline, rolls out Ramadan holiday guidelines. The daily new cases in Nigeria appear to be relatively low, according to data from the Nigeria Center for Disease Control (NCDC), from a daily count of 2,314 recorded on the 22nd of January. Earlier this year, the figures are now down to 179 new infections reported by the agency last night. This has increased the total number of confirmed cases in the country to over 161,000. The new cases are reported from 19 states, including 47 from Lagos, 21 in Kaduna, 18 in Rivers, 14 in Akwa Ibom, 11 cases from the FCT, and you find several other states as well. According to the center, in addition from the figures, the previous 24-hour cycle, persons who have recovered from the disease have increased by 320, raising the figures of those discharged across the country to 146,072. The NCDC says it includes 153 community recoveries in Lagos State managed in line with its guidelines. With 2 additional deaths reported last night, the country's fatality toll now stands at 2,018. Data from the center also shows that the number of active cases has now dropped from the over 13,000 cases and currently stands at 12,984. Globally, 120 million cases have been reported and over 2.6 million deaths. In the meantime, as countries race to vaccinate its population in Africa, the drive for vaccination has picked up pace across several countries, with 23.6 million doses of vaccines distributed across the continent. While 20 countries have rolled out the AstraZeneca vaccines, including Nigeria, 5 countries have rolled out the AstraZeneca and Sinopharm together. Only Rwanda has rolled out Moderna, AstraZeneca and BioNTech since February. 4 countries, including Gabon, Congo-Brazzaville, Zimbabwe, have rolled out the Chinese vaccine, Sinopharm. Algeria and Guinea are 2 countries that have rolled out Sinopharm and the Russian vaccine, Sputnik V. While South Africa, for now, is the first country on the continent to roll out the J&J after halting a planned rollout of the vaccine developed by AstraZeneca. In terms of administration, Morocco has vaccinated over 1 million of its population as at the 14th of March, followed by Ghana, where over 300,000 people have received their jabs. Most countries have a supply of below 10% of their population, except Seychelles, due to its population size. President Muhammadu Buhari is presiding over the Federal Executive Council. It's the 38th virtual meeting of the Council since the outbreak of the coronavirus pandemic in 2020. The Vice President, Professor Yemi Osinbajo, Secretary to the Government of the Federation and Chief of Staff to the President, physically attending the meeting, along with 11 ministers. The Head of Service and other ministers participated in the weekly cabinet meeting from their various offices. Staying in the Federal Capital Territory now, the FCT has flagged off the COVID-19 vaccination for its residents. The exercise was performed by the FCT Minister of State, Dr. Ramatu Tijani Aliyu, at the Asokoro District Hospital. The FCT received over 220,000 doses of the vaccines, and Dr. Tijani Aliyu insists that the vaccines are safe. She adds that the FCT can safely store, deliver, and administer the vaccines required to immunize all residents in this first phase of the exercise.
The FCTA will resolutely enforce all national guidelines and ensure that all stages of the vaccination rollout are equitably and fairly implemented, and all the 227,000 480 doses received are accounted for. And then we want other health workers, strategic leaders, military, paramilitary, as well as the FCTA/FCDA personnel, who will continue to receive theirs over the next 10 days. We may consider an extension of time to catch up for those who may miss their appointments.
The Director General of the NCDC, Dr. Chikwe Hekwazu, has called on Enugu residents to embrace the COVID vaccine while continuing with the non-pharmaceutical protocols of hand washing, social distancing in the fight against the pandemic. He was speaking during a working visit in Enugu where he met with the State Governor, Ifeanyi Ugwuanyi, to discuss challenges and successes as well as the way forward.
Today I went around some of the facilities where we've been managing our cases, spoke to the public health team, and I think we have a very robust response in Enugu. But this outbreak is not over. We have to keep pushing at it. So we have a new tool in our hands now, the vaccine. His Excellency flagged this up in Enugu yesterday. So we're here also to encourage. And personally took the vaccine himself, demonstrating his confidence in the vaccine and in what it provides. I have taken it myself, so we really look forward to encouraging everybody in Enugu to really take advantage of this vaccine, protect yourself, protect your families, your communities. We have confidence that with this vaccine, and in addition to all the other public health measures, we can get ahead of this and get back to the way of life that we love, walking together, eating together, praying together, dancing together, living together.
Over in River State, the state capital, residents of Port Harcourt are reacting to the planned commencement of mass vaccination for COVID-19 in the state. The River State government flagged off the rollout of the vaccine at the Government House following the delivery of 150,000 doses from the federal government. Well, some residents there have expressed readiness to be inoculated. Others give reservations about the AstraZeneca vaccine.
River State recorded its index case of the COVID-19 virus in March 2020, barely 1 month after the first case was reported in the country. For 1 year, the state government, like other governments around the world, has depended largely on the use of non-pharmaceutical protocols to control its spread. With nearly 7,000 infections and 98 deaths, the River State government seems to be heaving a sigh of relief with the arrival of 150,000 doses of the Oxford AstraZeneca COVID-19 vaccine in the state.
This is indeed a historical landmark in the fight against COVID-19. Government has demonstrated sufficient commitment to keep the people of River State safe.
While the Oxford AstraZeneca vaccine may be potent in the prevention and control of the COVID-19 virus, there has been a global suspicion of a side effect after a series of incidents involving blood clots, a concern River State residents want the government to probe properly.
If everybody is taking it and it's not causing anybody harm, I will want to take it.
I only have reservation because of the information we are hearing from other side about the blood clot when you take.
Despite the fears, a state government official who got inoculated just after the flag of exercise urges citizens to take personal responsibility to save humanity.
The effort we have done today, particularly myself, to take it, is my own contribution to eradicate this disease. So that with the vaccine now, I am very, very sure that not only will I not infect anybody, but nobody will also infect me.
Meanwhile, the River State Commissioner for Health and the State Coordinator, National Primary Healthcare Development Agency, says there is no cause to worry as the vaccine is safe.
There are other vaccines which will require as much as minus 70 degrees centigrade to protect. Some of those facilities we don't have in this part of the world.
It's safe. We have the facilities to store them here because We are storing them at the same temperature that we store our routine vaccine.
Though the use of the Oxford AstraZeneca vaccine has been halted in some countries after a series of adverse effects, Rivers State is hoping that the vaccine will be able to protect its citizens, as top government officials, staff and journalists in Government House have already taken their first jab.
Joining us, the Commissioner for Health, Rivers State. He joins me now on the program, Professor Prince Will Chike. Thank you for joining us on the program.
Thank you very much.
In your estimation, are Rivers residents willing to receive the COVID-19 vaccine?
Yes, of course. You saw me there. I did receive mine, the first start dose. And since yesterday, 12:30 till now, nothing. I've been trying, I want to use myself as guinea pig to see if there's anything. As a research medical scientist, not just as a doctor too. So I want to tell people that it's not as the so-called social media war and an economic war that is going on. As far as we are concerned, the medical field and the COVID-19 and the recent past have suffered a lot from the issue of social media and wrong information. Of course, COVID-19 is real. Denial should not be the best. I advise people to go and take the vaccine. It's safe. I'm here, I'm a witness to it, and I'm a live person who have taken it.
What other plans is the state adopting in its vaccination strategy?
Yes, we are following the advice from the PTF. First, we have the first phase, the second, the third, and the fourth phases. The first phase are for frontline workers, strategic political leaders, which was started yesterday. As at this morning, the frontline workers who have commenced inoculating them from the treatment centers, the one at the Eleme, the one at the stadium, the mini, and the other ones we have. We have treatment centers scattered around the state, thanks to the effort of His Excellency, the Governor, that made us to have all these treatment centers, including Bonny. So Bonny, some of our personnel will go to Bonny to give those personnel who are there. And then the other multinationals, SPDC, Total EMP, Indorama, and recently Saipem, that we have also given a nod to start their own treatment center. So they also have frontline personnel. So we're also going to give them. When we finish that phase, we'll now go to the next phase. We're already on course. There is nothing, no going back on it.
Can you tell us, confirm to us, if the governor, Nyesom Wike, has been vaccinated?
I didn't hear you very well.
Can you confirm to us if the governor has also taken his vaccination of the Oxford AstraZeneca?
If you watched the program yesterday, high-powered Rivers State government personnel were present in the flag off. And as far as I'm concerned, the deputy governor being there, representing the governor, and many top government personnel, including the speaker, the House of Assembly, and judges and members of Executive Council. The governor's own situation is not what we are talking. I think I should talk for that the governor have taken or not taken. I don't think is an issue now. As far as I'm concerned, the governor has been covered, as far as I can tell you.
But I did ask that question because, I mean, a lot of other state governors are indeed sort of leading that fight, because there is a lot of skepticism, hesitation with a lot of people who are not convinced about taking the Oxford AstraZeneca. And so that's really why I asked the question, if the governor is open to taking it, if he will take it, if he has taken it, and we haven't seen that.
No. You remember I said a while ago that the medical field has suffered enough from social media. Medicine is not showmanship. It's not showmanship. We have flagged off in Rivers State and we have taken up. That's what I'll tell you. Thank you.
We appreciate your time on the program. Commissioner for Health, Rivers State, Professor Prince Will Chike, thank you for joining us on the program.
Thank you.
Still to come, UAE government announces guidelines for Ramadan 2021. This is amid the coronavirus pandemic. Please stay with us. Welcome back. Ahead of this year's Ramadan, the UAE government continues to roll out its COVID-19 guidelines to Muslim faithful and other residents to curb any further spread of the virus. Well, this comes as it achieves a 50% population vaccination weeks ahead of its initial target date. Our UAE correspondent Maiwa Diguke reports.
Half of the United Arab Emirates population has gotten at least the first COVID-19 jab, a feat the government initially set out to achieve by the end of March. It's 2 weeks before the target date, and 52.46% of residents, which includes 70% of the elderly and those considered high risk, have now been vaccinated against coronavirus, according to health authorities. But the fight against the still raging pandemic, now in its second wave, is far from over. Over 2,000 new infections are recorded daily, a reality that has led government to place restrictions on the coming Ramadan festivities.
We can't get as many people in the house as we used to. So the traditional first day of Ramadan banquet in my house had to be put on hold. We would sometimes Zoom and eat together via Zoom, but it doesn't feel the same. So because of the restrictions on the number of people in the house, obviously we understand how important they are, but it has affected that spirit of togetherness of Ramadan. The other thing is the prayer in the mosque after iftar, because obviously mosques used to be full of worshippers at that time. The regulations on mosque capacity has affected that. The good news is that this Ramadan, mosques will be open, so people will start going again. Last Ramadan, mosques were closed for any gatherings. So there is hopefully light at the end of the tunnel. We can still go to the mosque and do the prayer after iftar, maybe not in the same numbers, but it's doable this year, which is amazing.
In addition to the ban on family and public gatherings, the new guidelines do not permit residents to perform acts of charity except through food banks and other approved means. In the last 10 days of Ramadan, which begins on the 13th or 14th of April, government says it will reassess the situation to possibly relax the rules. From Dubai in the United Arab Emirates, Maiwa Adegoke for Channels Television News.
Let's now talk about misinformation, myths and mischief around the COVID-19 vaccines. Dr. Shola Fola Alade joins us from Essex, Greater London. Thank you for joining us on the programme.
My pleasure.
Good evening. You recently met with the British Prime Minister, Boris Johnson, on COVID-19 vaccination in the UK. Tell us a bit about that meeting.
Yeah, well, the meeting was about the Prime Minister wanting to meet with representation from the Black community as regards the uptake of the COVID vaccine, because there's a bit of a challenge and a worry. Apparently, from one study, about 72% of the Black population say they are hesitant or reticent about taking the vaccine. And this is in the light of the fact that, you know, a Black person within the UK is 3 to 4 times more likely to suffer complications or fatalities or actually die from contracting the virus. So it's evidently a big worry. The Prime Minister wanted to hear our views, a few of us who are apparently community leaders, and he wanted to hear, you know, our opinions on it and ways to tackle this, what is supposed to be a big challenge for the UK government at the moment.
Dr. Folalade, in the UK, in your community, what kind of fears, myths have you heard around the coronavirus vaccines?
Well, quite a few. I would just, you know, divide them into broad headings. On the first set will be, you know, fears as a result of historical unethical practices and how that, you know, translates to the reception today. So people have heard about the Tuskegee experiment, where some Black men were, you know, unethically tried with syphilis, and, it caused deaths and a lot of fatalities. Also, I believe in Nigeria, some unethical practices, apparently with one or two pharmaceutical companies within, a Nigerian community. And then, out of that, there are thoughts like, oh, they want to exterminate or, wipe out Black people, so you would always have, adaptations and, modifications, myths from such things. And then also, the second broad heading would be medical. Medical, many people are worried about the speed of the development of the vaccine. That usually it will take a longer time to develop vaccines, but this has been developed within less than a year or so. Also, the newness of the type of vaccine that has been developed. The Moderna, I believe, and Pfizer, I think, are mRNA-based vaccines, and so the mRNA technology is a new form of vaccine development. So, like anything in life, anything new, people are hesitant and reticent about it. New technology, be it a phone or television, you have early adopters, and most people will wait to see the negative effects, or and all of that. And then the third medical reason would be the possible side effects. Even amongst medical personnel and nurses, I spoke to a group of medical professionals, and a few of them are reticent because they are concerned that because the vaccine only just came out, there's no history of we know about immediate side effects, but what about the longer term side effects? And so those kind of cares and concerns. And in recent time, within the last week, apparently it is said that within the European Union region, from the 10th of March, I believe, they've reported supposedly 30 cases of thromboembolism, that's blood clots. And, they are attributing it to the vaccine. It's not proven. AstraZeneca is disproving it and saying that, even within Europe, without a vaccine, that, more people die from blood clots, on a regular basis, even without the vaccine. So there's that contention going on. And the last thing is the religious factor. People are scared about the fact that this might be a way that a microchip, a nanochip might be imputed in people's bodies, and, the mark of the beast, and, monitoring people and all of that, kind of thing. So, broadly speaking, those are the fears and concerns.
So let me ask you, have you taken your jab? Which one, and how do you feel?
Well, interestingly, I took mine yesterday. Myself and my wife, strolled in to take the jab. And we got the Oxford AstraZeneca one. We didn't have a choice. That was what was available. We did take it. I do feel some soreness on my arm, but, that's to be expected with any vaccine. Overnight, I felt a little bit fluish, a little mild headache and all of that. That is also expected with, vaccination. And I feel much better now.
All right. We'd like to thank you, Dr. Shola Folalade, for talking to us on the program.
My pleasure.
In the meantime, Brazil is set to be experiencing what has been described as a historic collapse of its health services. Intensive care units are set to be running out of capacity as the number of people contracting the coronavirus has risen in recent weeks. The leading health institution says COVID-19 units in all but 2 of the country's 27 states are at or above 80% capacity. We'll continue to take responsibility. Visit our website, channelstv.com, for more updates and a better understanding of the pandemic. You can find several other stories there, all at your fingertips. Thank you for watching the program this evening. I'm Millicent Walker. Stay healthy.